More than 2,000 cases of obstetrics fistula are reported in Cameroon each year, without counting the unreported cases. Far from being a sort of punishment or curse on the woman for some reason, as some people tend to believe, obstetric fistula is an abnormal connection between the rectum and the vagina. Dr. Kapgang Kevin, gynecologist obstetrician, sheds more light.
A fistula is an abnormal communication between two organs. And for obstetric fistula, it's an abnormal communication between the bladder and the vagina, or the vagina and the rectum. It can lead to leakage of urine per vagina continuously, or passage of stools per vagina continuously.
Depending on the size and location of the fistula, there may be foul-smelling vaginal discharge or passage of stool from the vagina. Causes include injury during childbirth, cancer, radiation therapy, and surgical complications.
Obstetric fistulas can be caused by prolonged diastolic labor, instrumental deliveries, or direct trauma during labor, like perineal tears going to the anus. It can also be caused by abortions that are being managed by instruments that can cause direct tears either to the bladder or the rectum.
Some such fistulas may close on their own, but most need to be repaired surgically.
The treatment is surgical repair, fistulography, that can be done by competent gynecologists.
Often stigmatized and often accused of being punished for their sins by some traditions, women suffering from obstetric fistula can fully be treated if they follow medical advice.
After repair of fistulas, we have to leave to maintain the urinary catheter for about 14 to 20 days. We can do sit bath for about 5 to 10 days, and we have to do physical rest and sexual rest. The patient can resume sexual intercourse after about 3 to 6 months, and even when she resumes the sexual intercourse, it has to be soft. It does not have to be traumatic.
And instead of staying behind and dying in shame, women are encouraged to speak out, seek help, and be treated. Once more, Dr. Kamgang Kevin, gynecologist obstetrician, resident doctor at the Gynecobstetrics and Pediatrics Hospital in Gusau, Yaoundé.
They have to come to the hospital. They have to open their mouth and tell us what is their problem so that we can take care of them. It is a problem that we can take care of. It is a problem that can be repaired. They have to come to the hospital and we will find a solution to their problem.
The International Day to End Obstetric Fistula is observed annually on May 23rd. This year's theme, Her Health, Her Right, Shaping a Future Without Fistula, underscores a powerful truth that every woman and girl has the fundamental right to health, particularly sexual and reproductive health, and that the continued existence of obstetric fistula is a clear violation of that right. Obstetric fistula is preventable. It can be largely avoided by delaying the age of first pregnancy, the cessation of harmful traditional practices, and timely access to obstetric care. Preventing and managing obstetric fistula contributes to Sustainable Development Goal 3 of improving maternal health.
« 23 mai, Journée internationale pour l'élimination de la vésicule obstétricale. Cette maladie qui touche uniquement les femmes est une perforation entre le vagin et la vessie et ou le rectum, causant ainsi un dysfonctionnement génital. Elle provoque une fuite d'urine et ou de matière fécale par le vagin, entraînant à long terme des problèmes médicaux chroniques. Cette lésion survient lors d'un accouchement dû à un travail prolongé en absence de soins obstétricaux rapides et de qualité. Cette affection causée par des complications lors d'un accouchement est souvent source d'humiliation pour la femme. D'aucuns l'attribuent à de la sorcellerie ou à une malédiction. Pourtant, c'est une maladie curable. Une opération est effectuée sur le patient pour réparer le système génital endommagé.
The outgoing ambassador of the People's Republic of China was received in audience this May 22nd, 2025 by the Right Honorable Speaker of the National Assembly in his cabinet. The Right Honorable Kafai Yege Jibri and the Chinese diplomat Wang Yingwu discussed cooperation and the strengthening of friendly relations between China and Cameroon. They discussed upcoming projects while also looking at cooperation achievements such as the Pobia Glass House, which is one of the latest Chinese realizations on Cameroonian soil. The two officials took time to exchange views on the development of other areas of cooperation, such as education, health, economy, and culture. Another area of focus during the discussions was the strengthening of friendly ties between parliamentarians through friendship groups. The discussion between the Right Honorable Speaker and the Chinese diplomat were fruitful. The speaker was assisted during this audience by Mr. Essien Andri Noel, the Secretary General of the National Assembly, El Ahaji Buka Abdurrahim, the Speaker's Chief of Staff, and other senior officials of the National Assembly. This meeting also highlights the ongoing efforts to deepen China-Cameroon relations and explore new areas of cooperation.
The first group of Cameroonian Muslim pilgrims for Hajj 2025 are already in the Holy Land, Mecca, Saudi Arabia. They departed from the Garwa International Airport on May 22, 2025, under the supervision of the Minister of Territorial Administration, Paula Tanganji. They left on board an Ethiopian airline flight which took off at 1 p.m. The minister was welcomed on site by regional authorities and Muslim dignitaries. During the event, Minister Tanganji commended President Paul Biya for his pivotal role in the swift rehabilitation of the Garwa International Airport, notably the restoration of the airport's runway, which was previously in disrepair, causing its closure. This repair, done in less than 9 days, allows for large aircraft like the Boeing 777 and Airbus A350 to operate once more from Garwa. Pilgrims expressed deep gratitude to President Paul Biya, stating that their spiritual journey would not have been possible without his support. Minat Boss used the opportunity to emphasize on government's dedication to ensuring a safe and organized pilgrimage for over 4,500 selected individuals. Beyond the vital infrastructure improvements, the government has also provided significant financial aid to the pilgrims, totaling approximately 1.5 billion CFA francs. The newly renovated Garwa International Airport is expected to have a lasting positive impact beyond religious travel, boosting economic activities, improving connectivity, and benefiting local businesses and communities in the region.
The environment is calm and quiet, giving a clear definition of an examination atmosphere. Just like elsewhere at the Messi International School in Yaoundé, from nursery 1 to primary 6, the pupils are negotiating success with the benches. The exams are written under clear instructions and tight invigilation, with their belongings placed outside or in front of the class, giving no room for cheating. The exam, known as promotion examination, gives successful candidates access to the next class. Though the Class 6 pupils are equally sitting for the exercise, their hopes lie on the common entrance and first school living certificate examinations. It is worth noting that the promotion examination is the last exam of the school year for those not sitting for any official examination. Therefore, the ongoing exams mark the end of the 2024-2025 academic year in Cameroon. It is also important to note that after the exams, the school will be preparing to send off the pupils, especially those in Class 6, through a graduation ceremony.